clinical documents are written by clinicians, professionals, and they come with a certain style. But I also want to, in part two of my talk, I actually want to talk about beyond clinical documents, also talk about how NLP could be applied to what is called user-generated content. So these are content, these are texts written by the patients, their families, and their caregivers. And it's in that context that I'll bring in, mental wellness and psychiatric, applications. And so this is, roughly the outline of my talk. Feel free to interrupt me at any time if you have, questions and comments. But let me begin by just talking about why we want to think about natural language processing if you are not familiar with this topic. We all know that in medical care, whether it's in Canada, in North America, in Europe, in Germany, traditionally there's a lot of unstructured text data that has been used, accumulated. This unstructured data is typically medical reports of so many different kinds, and then maybe other clinical documents. Now, in the past 10 years or so, I'm sure many of you are aware of that machine learning has been applied quite a lot to healthcare, applications. Oftentimes, the machine learning applied to imaging. Imaging is a hot topic for radiology. There's also a lot of machine learning applied to electronic health records, insurance data, etc. But these are primarily structured relational data when it comes to electronic health records, and of course, imaging is a different types of data. So there is indeed a lot of opportunities, a lot of work, in fact, to be done to see how machine learning and could be applied to the unstructured text data. Now, to do that is where we need to use natural language processing. Now, I think one of the reasons why there is the mining on the unstructured text data has been a somewhat overlooked area is, there is always a concern, and there's this, skepticism whether NLP is advanced enough to interpret free-form languages. And so, if I want you to remember one thing from my presentation today, is to say that yes, in fact, NLP techniques is actually more than good enough. So in the next 40 minutes or so, I'm going to give you some examples, based on what we have done or based on what we are doing. So let me first use a use case of the care of a cancer patient. And so I want to think about the care of a cancer patient in different phases. First of all, there's a diagnosis phase. During the diagnosis, the patients typically need to go through multiple tests, and each test generates reports. And this test could be biopsies, could be surgical, and then there's pathology reports. There's radiation. There's radiology reports, and so on. And let's say that unfortunately the diagnosis is confirmed and the patient has some form of a cancer, and then in phase 2, there's go through a lot of treatments, rounds and rounds of treatment reports, maybe chemotherapy, radiation, immunotherapy. Different types of treatment. Every single types of treatment would generate some kind of reports. And let's just say that the cancer patient, cancer is successfully treated. That is not the end of it, because there may be a relapse, and so post remission, there will still be routine checkup. There might be more tests, and if unfortunately relapse happen, then it goes back to phase 1, phase 2. So during the care of cancer patients over many months and sometimes over many years, sometimes over 2 decades, there are so many unstructured text that has been generated. Now, what is the current practice?
Neugierig? Den kompletten Vortrag finden Sie im Intranet der GMDS. Einfach anmelden und den Menüpunkt Bild und Videomaterial anklicken. Werden Sie Mitglied in der GMDS.